Welcome to Dental Success Beyond Chairside, the podcast that's dedicated to revolutionising the way dental professionals succeed beyond the dental chair. Join us for a unique blend of insightful interviews with industry experts to help you thrive in your dental specialist practice. In each 20-minute episode, we'll delve into a variety of subjects, including HR, marketing, innovative techniques and systems, and AI to help transform your practice and unlock its full potential. Whether you're a dentist or specialist looking to enhance your practice, this podcast is your go-to resource for professional, personal, and profitable success. Hello, everyone, and welcome to today's episode of Practice Success Beyond the Dental Chair. Do you wonder if you're misdiagnosing conditions from dental x-rays? Would you like to help identify various issues like tooth decay, cracked crowns, or root abscesses? Today, I'm lucky to be joined by Dr. Kyle Stanley, listed among the world's top 100 doctors in dentistry. He's a dedicated advocate for mental health and also at the forefront of dental innovations and one of the few experts in dental AI. He's the co-founder of Pearl, an AI-generated tool assisting dentists in diagnosing conditions from dental x-rays. Dr. Stanley, can you share your story about yourself and the innovation of Pearl AI?
Yeah, so I'm happy to be here. I'm a dentist that lives in Southern California. My practice is in Beverly Hills. And one of my patients came to me during a hygiene visit and said, I'm thinking about starting an AI company for dentistry. Would you like to help me? What I didn't know was that he was an extreme expert in AI, not in dentistry or in healthcare, but in the advertising space. And talked a little bit, we had a few meetings, and we ended up starting this company that is now called Pearl, and in over 120 countries around the world, really the global leader in dental AI. It was something that I never thought I would be doing. You know, I was a speaker and a dentist and a researcher. I was not an AI expert many years ago, but after putting 7 years of my life into this, it's been a very interesting experience, and I think it'll be a part of my legacy now that we have really changed dentistry forever by introducing it.
Absolutely. And that it started so long ago because AI is obviously a very big word now in everywhere, the world, worldwide.
Yes.
So when he approached you and said, do you want to join me in with AI? And what did he propose for you both to do?
It was really an exploration. It was just, hey, why don't you come over to our company? Because they had a company that was doing advertising,
yes,
AI, basically analyzing every image on the internet and then selling ads based on those images. And so he said, why don't you come over to our company, talk to us, teach us a little bit about dentistry, we'll teach you about AI, and we can explore this idea. And so we explored that idea over a few months, and then it turned into a real kind of great idea that we thought we could take forward. We ended up spinning that company out, raising our own round of financing, and he ended up stepping down from that company to start this company with me and my two co-founders. So really, really, it's not normal. It's not normal. Dentists don't normally do this, right? But when you're in LA, we live in a place called like Silicon Beach. It's like Silicon Valley, but by the beach in LA now. So we have a lot of tech companies in the area. We have every tech company you can think of has some kind of an office in Silicon Beach. So it's fairly normal in our area, it seems like.
So now that you can analyze, and you obviously got together to do x-rays and
Yes.
an analysis of the x-rays to help the clinicians in dentistry, how does it go about it? How do you integrate it into your dental practices?
Yeah, so there's a few different ways of doing it. One way is just integrating with your imaging sensor. So you have a digital imaging sensor. Now, every time you take an image, you get this extra layer over your images that instead of being in black and white, is in color and can show you pathology and natural anatomy and, some pathologies even. But then the better way is actually to incorporate it with your x-rays and your practice management system. So not only will it assist in finding pathology, but then it will cross-reference and look in your practice management system and say, has this been treatment planned? So tooth by tooth, it can go by and verify what's happening in your treatment plan just to give you an extra set of eyes.
That's fantastic. With the integration into practice management system, there's so many worldwide.
Yes.
How many are you actually integrated with?
We're integrated with about 80% of the market. In the countries that we are in, about 80% of the market. And I know in Australia, I don't know the exact numbers, but most of the big ones we have some integrations with.
Oh, that's fantastic news. And the outcomes of that you've seen in working with dental practices and them adopting this technology, how has it worked for the practice, for patients, and for clinical outcomes?
Yeah, so I liked how you asked that, and let's talk about each one of those. I think for the patients, one of the best things is showing them in color what we see in black and white. So, us dental professionals, we look at an image, we see where there's a little bit of caries, where there's a periapical radiolucency, where there's a slight little amount of bone loss, where there's an open margin, and we show it to the patients and they go, are these toes? Like, what are we looking at? They have no idea, right? But when you have it in color, it's easy to say, you see this little pink area. You see how it's gone through the blue and it's now in the purple, for example. That means you're into the spongy part of your tooth, the sensitive part of your tooth. And you see that little red area? That's the nerve. We don't want it to get to there. And so you can start having these intelligent conversations with your patients so that they really feel like it's more than one doctor looking at their images. The program was trained by thousands of doctors around the world. So it's not so objective. Or it's not so subjective. It's a lot more objective. Mm. Now, of course, it's the dentist's final decision on what they see, because an AI is fantastic. Ours is very good, but by no means is it, just like how a human isn't perfect. But what we saw is in the FDA trials, which is what we have to do in the United States, every time you take a practitioner and you add AI to them, they always get better. No matter what, because sometimes the AI misses something, but the doctor finds it. Sometimes the doctor misses something, but the AI finds it. Sometimes there's a false positive or a false negative, but together they always get better. So that's how it helps the patient. For the patient, I think it is a big trust builder. It helps them say yes to treatment because they really visualize it, know what's understanding. And so that builds the relationship with the practitioner. I think for the practitioner, there is one thing, which is peace of mind, knowing that more than likely they're not going to miss something. I mean, let's be honest, we're busy. We're doing hygiene checks. We're prepping this tooth. We're injecting this patient. We're extracting this patient. Our husband or wife is calling us. The contractor at home hit a leak in our house. I mean, we're doing a lot of things, right? We're parents, so we've got a lot to think about. So there's the peace of mind. Another aspect of it is a little bit of delegation, a little bit of, your hygienist, for example, or your assistant maybe can even start pointing things out before you get in the room. So they could look at this and say, hey, you see this little pink area? Our AI engine that we use is showing us something. I'm going to have Dr. Stanley come take a look when he comes in. Already they're prepared to talk about caries, for example, right? So there's a little bit of delegation. And then I think for the practice side, which I think would be the last side, is of course the financial part of it.
Absolutely.
I mean, this pays for itself usually for the year within about 6 to 8 weeks. And after that, it's all gravy after that.
Yes. And it's about patient experience, which is fantastic. And I think even though it's in color, to be in black and white and to be easy to understand from the patient perspective, to get that. And then to have your treatment coordinator, your assistant, your hygienist actually explain it. It's already in their head and they're already thinking about it before you've actually come in. And it does enhance that experience by seeing that they have got that objectivity and they can actually see it's actually true. And for practitioners who are on their own and sometimes they don't have mentors at their practice and, things happen, as you said, and they're on their own, it does give them that peace of mind as well. And treatment conversions is your biggest financial gain. So to get people to accept treatment rather than just go blah, 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 and speak in a foreign language that the patient doesn't understand and thinks, oh no, they're just ripping me off.
Yeah.
I'm not going to do that. So by tracking those treatment conversions, and as you're saying, if it pays itself off in 6 to 8 weeks in that year, with regard to implementation, integration, training, how does that work, Kyle?
Yeah, it's fairly simple in the sense of once we're integrated, we do some training. We do like to do separate training with the team as opposed to the doctor or the front office team, the assistants, because there's different ways of using this. But it's fairly simple in the sense that you take an x-ray how you normally take an x-ray, but instead of pulling up how you would view it in your traditional viewer, you pull up Pearl. Now, we do have some integrations where we have a native integration so that you literally don't have to change anything. It's just you press the AI button on certain practice management systems and the AI pops up. So that's even better when you have that. But it's a very small change management, and change management can be challenging in any practice. As we know, humans don't like to change, especially our team members. They don't like to change. They hate when we go out to do a continuing education course. We come back and we're so excited about this new thing, and they're like, it's one more thing for me to learn, right? Mm. And I think that's why this is nice, because it's very low change management. So it's like a low cost, high yield in that sense, and the cost being that change.
So great, because as you said, people are resistant to change, and it's just, if it's going to be hard, it just doesn't happen. So integrating it into the practice easily through the practice management system and through your team with that dedicated training. And have you got the ongoing support as well, Kyle?
That's right. Yep. Always have ongoing support. And if there's anything wrong, we have local people. So
that's absolutely excellent. So Pearl, for any practice, it seems like a little bit of a no-brainer. As you said early on, you talked about how you got into AI 7 years ago. Things are happening over in LA and you're in a different field. You've actually grown a lot with what you're doing in the dental industry as well, Kyle. Can you tell us a bit about what you've been doing since Pearl?
Yeah, so I'm not running the day-to-day at Pearl anymore, and the company has gotten to a point where it kind of runs itself, and we're expanding, and a lot more people are being brought on, and so I've really put a lot of effort into helping my colleagues around the world with mental wellness. This was something that I suffered with. I went through burnout. I wanted to quit dentistry. I was going through anxiety and depression. And on the outside, everything looked great. But on the inside, I was really suffering. I wasn't communicating with my patients well, with my team well. I was going through litigation with both a team member and a patient. And I needed to learn. So I went on this journey and I started learning positive psychology, the psychology of overachievers, techniques on communication, how to set expectations, how to set boundaries, what my true purpose is in life, exercising, diet, eating right, sleeping. And because I'm a speaker and I speak about 40 times a year all over the world, I started talking a little bit about this. And then people came up to me and said, hey, I'm going through this, or my husband's going through this, my wife, my colleague, do you have anything that you can help us with? And at the time I didn't. And really, the pandemic helped me have a little bit of time, and I started creating courses and resources for people around the world. And now, I'm proud to say that I'm one of the biggest voices in dentistry, helping doctors around the world with mental health. I've created multiple online programs, in-person programs through my Lightside Dentistry group, and it's been one of the most rewarding things that I've done in dentistry.
That is so great, Kyle. My husband, as you know, he did have a nervous breakdown, and he is now no longer practicing. He just can't even go into a dental practice anymore. And interestingly, what you said by sharing your story, how people came up to you, I was speaking to him last week, and he goes, I'm really open about what happened to me, and everyone knows, and he's in a windsurfing group, and he just said, so many people come up to me and go, oh, That happened to me. I've never spoken about it before. So having someone like you advocate in that dental industry, on our previous episode, we had Dr. Makar, who did suffer burnout and she did quit. She didn't know what to do. Having people like you that you can get online as well and have these courses with understanding. And I think, you know, as I'm not a clinician myself, but the clinicians I meet and have been around are just amazingly intelligent. As you said, they are high achievers. And there's all of this propensity from people when they go to the dentist, they go, nothing against you, but I hate dentists. And you don't want to give pain because you just want to help people. And it's all of these things that are dragging you down. And then, you know, people go, oh, you're paying for my car. I'm paying for your car. And that's dragging you down as well. It's like, I don't want to charge them. I feel really bad. So having you be able to give back worldwide on a big scale is just fantastic. And knowing what it's like, which is like Dr. Makar as well, she was the same. So she didn't have anyone. And when I spoke to her, I said, what would you do differently if you had you now? And that's just like having you, Kyle. So that's fantastic that we've been able to share about this as well, because in this series of dental innovations, it's about what dentists have identified and they've seen a gap. And you were lucky to obviously have someone come in to share that with you with Pearl, but then you felt it yourself and you've actually done something to help the industry, which is just magical. So people like you are fantastic. So thank you. Have you got anything else that you'd like to share with us, Kyle, that we haven't covered?
No, I think that's it. I mean, when you think about any type of innovation, I think there's a right time to jump into anything. If you're too early, the innovation isn't ready, it's too expensive, it's clunky, there's no integrations. If you're too late, you don't get a lot of the benefits of it because it's old news. And there is a sweet spot, and usually that's when around 10 or 20% of the market is using this product. And that, I just want to say, that's where AI is now. And so that sweet spot only lasts for maybe 2 years. And so if anyone's thinking like, when is the time to jump in? Is it ready? Now's the time. You know, my dad was always a late adopter in dentistry and I was always an early adopter in dentistry, which means both of us suffer. I suffered because I bought things too early. They're not ready. They're clunky. You know, my dad suffers because he doesn't get the marketing aspect of it. He doesn't get, you know, the deals that come and that kind of thing. So be the smart dentist in that sweet spot and jump in, and not just AI, but any technology when about 10 or 20% of the market is using it.
I think that is really great advice, Kyle. And evidence-based dentistry through seeing people in that very not early adoption. But now, as you said as well, the AI with Pearl, it wasn't perfect, but then it did the images. And I do remember someone saying with ChatGPT, they were doing psychology and they got a D, and within 3 months it was an A+. And I think with Pearl, as you said, because the dentists are picking up, more people are adopting the technology. So AI is learning through dental practitioners and then bringing that in. So that's just fantastic. And I do agree. And as you said, it can help your patients. It helps your team. You can create yourself financially, get better with your treatment conversions and adoptions, and people will then refer to you as well. So you're going to attract the people that you want, you can retain them, and then they can refer to you as well. Thank you so much for coming on today, Kyle. We really appreciated having you sharing your story with us. For more information about Dr. Stanley and Pearl, including links to their website and social media profiles, please check out the episode description. Thank you again, Kyle, for coming on and speaking about Pearl, as well as your obviously mental health things. Really appreciated it. Thank you so much.
Thank you. Yeah, I hope to be back in Australia. It's been a few years, so hope to be back soon.
Oh, that would be great. All right. Thank you. Bye.
Thank you.
In our next episode of Dental Success Beyond Chairside, we're joined by Dr. Jeevan Sivalingam, co-founder of Jeev, a dental management software that modernises payment processes to contracted dentists and eliminates the risks of outdated cash handling. If you're looking to enhance financial transparency and efficiency in your practice, this episode is for you. Join in every second Saturday for insights into GPay and more on dental success beyond Chairside. Thanks for listening.